Hello, I'm Mayor John Peat from the City of Cypress. I'd like to welcome everyone to today's Pandemic Recovery Town Hall meeting. Over the next few months, mayors from West Orange County Cities Coalition will be holding bi-weekly town hall meetings with elected officials to bring the latest information on important topics to our residents. Online with us today listening is our co-host, Mark Churko, the Mayor of Los Alamitos. And joining me in today's webinar is Seal Beach Mayor Joe Kalmick.
Good morning, everyone. Actually, good afternoon now. Thank you so much for attending this, and thank you very much to our two guests for helping us kick off this program.
So today we'd like to thank and welcome Supervisor Andrew Do, who's chairman of the Orange County Board of Supervisors from the 1st District, and Dr. Clayton Chau, director of the Orange County Healthcare Agency and the County Health Officer. Gentlemen, thank you both for joining us and helping us bring important information to the residents of the West County.
Thank you, Mayor Peat and Mayor Kalmick. Also, I believe on the line is Mayor Churko. It's a pleasure to be here, and I'm proud to represent the county and address all of you today.
So we'd like to start with you, Supervisor Do, and just ask you to give us a brief update on some of the things that are happening in the county, things that our residents really would like to know about.
Sure. As you know, you are about to get a new supervisor. So before that supervisor takes office, I'm proud to represent the county in presenting an update to all of your residents. And I applaud all of you for doing this. This is a great event. We are at a point in the county in the state actually, where things are very much in flux. And Dr. Chow will present in more details. What I would like to present is maybe an overview of the role that the county plays in terms of responding to the pandemic, and how does the county play our role vis-a-vis what is it that the county health officer, Dr. Chow, is responsible for, and what is it that the Board of Supervisors can do to help further that policy. When you on any matters that have to do with the state guidelines and the health standards and the tier system, and which sector can open, and the requirements in order to comply with state guidelines, that's where the medical expert, our health officer, Dr. Chow, comes in. But in furtherance of that type of policy, in terms of standing up programs, standing up the points of dispensing, which we call pods, the vaccination centers, staffing, how do we get the resource, how do we procure supplies and equipment and personnel. All of those logistical decisions are made with input from the Board of Supervisors and ultimately approved at our board meetings. Currently, we are in a great position in that the daily case rate is the only metric where we are in the red tier, which is already good. But by every other metric, we are actually even better than red. We are in the orange tier, which include the test positivity rate, the health equity positivity rate, and the test per 100,000. So these are all good measures. And Dr. Chow will explain in further detail that because we are in such a good position, and we have been in that position for over a week now, by tomorrow, there may be announcements from the state that the progress that we have made over the last week or almost 2 weeks will actually count towards us being able to move into the orange tier even earlier. Into the red tier even earlier. And then if we achieve certain metrics statewide, the standard in order to move into the orange tier will be lowered. So that means that will accelerate our ability to even get into a better tier than red soon. We have seen that having led to school sports being able to resume once again, and even for high contact sports like football, basketball, and rugby. They can engage in sports now as long as they are tested twice a week. Um, the different capacity in terms of our gym and our restaurants and movie theaters, all of that we believe when we reach the red tier, we will be able to start open up to, of course, at a reduced capacity for indoor dining. We also have retail stores having increase in capacity. Gyms and fitness studio will be able to open, and museums also can open for indoor attendance at a reduced capacity. So there are many changes for the better that we see going on right now.
Thank you.
Very good. Dr. Chow, I want to welcome you and would ask you if you'd please give us an update on, for the county in general with regard to the vaccination progress and so forth.
Thank you so much, Mayor, and thank you to all of you for the invitation to speak to your constituent, to our citizens in the west part of Orange County. As Chairman Do mentioned earlier, we have made great progress. I want to ensure you that every single vaccine dose that allocated to Orange County have been given in arms within a time span of 7 days, which is the standard that the state has set up for all county. We have done so with the willingness from the community to participate in this. You probably have heard me publicly talk about how the only way for us to get out of this pandemic is truly people willing to receive the vaccine. We need to be able to achieve herd immunity or community immunity in order for us to go back to a state of what it was, resembling of as close to normal as we can. And at this point, to beat this pandemic, we have no other options beside the vaccine. And we're fortunate enough that in Orange County, there are many, many people who are excited and wanted to receive the vaccine. That is good. But the headache for me is the demand exceeding way more than the amount of vaccine that are allocated to us. So since December 16 of 2020, that is the day that I will never ever forget in my life. That is the first day in many months that Orange County finally see hope in the horizon, right? I call this the beginning of the end of COVID. That's the day when we received our very first shipment of the vaccine. We are now close to 3 months in the making, and there has been over 894,000 doses of vaccine in Orange County. If you look at statewide, we rank third in all of those efforts. And when you look at the number per 100K, we actually exceeded LA County even. And so I'm very proud of that effort. That effort is public-private, different agencies in the county, our local governments. All of your staff have been very supportive in that effort. Our fire departments, our police department and sheriff, and community-based organization. So the goal is to make sure that we get the vaccines to those who are currently eligible for the vaccine, but pay true attention to those who are vulnerable, right? The senior who have difficulty in getting out to the vaccine sites or even to their doctor's office for the vaccine, if their doctor is able to offer the vaccine, or the individual ethnic group that have been heavily impacted all over the country, all over the state, including Orange County. And as you probably have heard, the two ethnic groups that have been disproportionately affected are our Latinx community and our Black community. And so there has been great effort from the county and all of our partners in really have a concerted effort in outreaching to those community members and educate on the fact That's important, the facts about the vaccine, and also ensure that there's true access to the vaccine for those who want it. Um, we are most proud of all the work that we have done in the mobile part that you heard. I know the effort has been great, and there are still people who still want the vaccine, but we received very little vaccine. Overall, the entire county of 3.2 million, or 2.6 if you're only counting those who are eligible, meaning adults 16 and older. We are only receiving roughly about 40,000 doses per week. 40,000 doses per week. That is not a whole lot. We can all do the math. How do you do this in a way that is equitable? So what we've done is we're looking at the lowest social economic area in Orange County, and we have an effort to go out and get especially the senior in those areas to come out for the vaccine. Because if you notice, when we look at our own data, 75% of those who have died in Orange County are seniors, 65 and older. And then if you look at those seniors who live in our lowest SES area compared to their peers outside of those areas, they had a 200% higher risk of getting infected. And then once they get infected, have a worse outcome than their peer at the same age outside of those areas. So we know we need to have an effort in doing it in a way that would get the most vulnerable population vaccinated and ensure that everybody have equitable access to the vaccine. I'm very hopeful that by next month or the end of this month, there will be more vaccine available. You all heard that President Biden announced that perhaps very likely that by the end of May, the US will have enough or plenty of vaccine for those adults who want the vaccine. You heard that the vaccine maker have stepped up and producing more vaccine, and the US have had a chance to purchase more vaccine. So more vaccines are coming. We currently have 3 different platforms of vaccine. You probably heard about it. Moderna and Pfizer since the beginning of the vaccine effort, and then J&J, which was added less than 2 weeks ago. There are more vaccine productions will submit their applications for the FDA to approve starting in April. So there are more chances for more vaccines to come. So we will make sure that every single drop of vaccine that we get will be put in on. So I'm going to stop there.
Until we reach that 70 to 80% mass immunization, Mayor, I would encourage that we encourage our constituents, our residents, to continue to test. That's the only way for us to maintain surveillance on the spread of COVID until we can get the number of doses that we need to mass vaccinate as many people as we can. And hopefully we have Operation Independence, which is July 4th of 2021. Dr. Chow set that goal as the goal that we should be able to vaccinate every adult and every person who qualifies who wants a vaccine.
Great. Thank you very much. Look forward to enjoying the summer this year.
Yes.
Supervisor Do, we would like to ask you a quick question. You mentioned about sports opening in the schools. What could you tell us about youth sports for families and residents in the youth sports leagues? When will they be able to start participating in games?
The sports that are less contact, they have already been allowed to engage in since the end of February. Baseball, softball, gymnastics, sports that do not engage in the physical contact as much. And I believe football, basketball, and rugby are allowed now, but they have to be tested for any players over 13 at least once a week, coaches and players over 13. And the test results have to be within 24 hours of competition. So those are the basic guidelines, and Dr. Chow can certainly elucidate on specific sports and situations. But I'm very happy that our children are able to engage in sports. I'm a huge believer in it's good for their mental health in addition to physical health, and the last year I think has done immeasurable harm already. And the sooner we can get back to it, the better it is for our children.
Thank you, Chairman Do. If I may give a bit more detail. So as Chairman Do mentioned, when we reach certain number of case rate below 14 per 100 case, which we have for over a week now, we are currently at, let me see, I can give you the exact number. We are currently at 5 per 100K. Then the heavy contact sport like rugby, football, and even water polo would be allowed to be conducted outdoor only in the purple or red tier. And then there are certain conditions that you have to do, and Chairman Do has alluded to that, is frequent testing, testing within 24 hours before the game. Now, currently, their competition allow between 2 teams, but no spectator allowed yet. That's important information that folks need to realize. I know the state is working on an update guideline for youth sport in view of more people getting vaccinated. And you know, the CDC yesterday has issued a new set of recommendations for people, specifically for people who've been vaccinated. But California are currently still in conversation about the modified or the revised guidelines as is related to people who have been vaccinated. But as far as the sport go, for all sports, especially youth sport now, there's no spectator. There are certain guidance for the high contact sports. But I think it is good news, as Chairman Do mentioned, our kid is now able to, at least outdoor, do physical exercise and what have you. And so I think that's a very important achievement that we all as a community have achieved. So look forward to better measures and then more opportunity for our students to engage with each other. So.
Great, thank you.
Great. Dr. Chow, I have a question. You just mentioned a few moments ago that even with all of the choices now, the vaccines, that we're still only receiving approximately 40,000 doses a week. And I know that that's caused you to have to make some very difficult decisions as to how to disperse those doses. So given those considerations, we know that, we have super pods that have been placed around the county, and that we understand there will be more, coming online. But given that there are currently no plans for a super site on the west end of the county, and given that we have a higher concentration of seniors than in most other areas, what's the likelihood that we might even have a mobile vaccine setup that would be available for us, even if it was only a couple of days a week?
Thank you, Mayor. And so we have in negotiation and finalized plan for several superpod sites throughout Orange County, including on the west side. And so we do have plan. Once we have more vaccine come to Orange County, many of those superpod will be stood up to ensure that we push the vaccine out as fast as we can. I'm not sure if you're aware, at least in Leisure Worlds, and I think it's Mayor, your city,
Yes,
we have been working closely with Hope Hospital and several other entities and Memorial Care to specifically vaccinate seniors in Leisure Worlds. I can give you the update number on how many seniors in those in that area have been vaccinated. So there have been efforts in Leisure World, sir. And then there are plans for a mobile pod to come through the west side.
Thank you.
All right, Supervisor Do, there are many sources of data and places for people to go look. Could you give us some information where the best information for city-specific COVID data and the latest updates where our residents might best find that information?
Yes, our county website, the COVID update website, will have links that will lead to the breakdown by city, and they just have to click onto the city and it will populate the numbers for that city. And the aggregate number, sometimes people get confused and they may check online at the state and then with our number and they see maybe a discrepancy and they wonder if it's accurate. There's always a lag when it comes to the state and also a lag locally here. So sometimes the trend might be a little bit slow and then it accelerates because we just happen to get more data kind of being reported on a particular day than others. So it's important that people have to kind of go back and look at the date of incident on the data in order to accurately see a trend. Don't just rely on the report numbers because that could fluctuate and it has lag time and it's kind of at the mercy of just happenstance. And then the coordination between the county and the state can also add to that discrepancy too.
Okay, thank you very much.
If I may add to that, Chairman Do, I think I've done a good job because you explained that so well.
I'm a good teacher.
Our website, we also have added the map for the vaccine as well. And Chairman Do is right. There will always be a delta difference between the county and the number published on the state site because it depends on when we go up to the state and pull the data to come down and put on our website. And so people need to know that there will always be a delta difference. And then as you all remember, we have always had a map of cases, positivity rate per city, per zip code. So we have done that at least since I stepped into my role in May. And so we just recently added the map for the vaccine as well. With a caveat, the state system where everybody reports the number of folks who get vaccinated by zip code. When the state pull that data to the state system, there's a glitch and only 10% of the individual that the state counted in the state website has an associated a zip code with it, right? And so it is not accurate. You probably heard about Othina. So the Board of Supervisors supported healthcare agencies to develop an app solution or an online solution to keep track of who get vaccinated, knowing that the system at the state level will be complicated, will have full glitches, and so we want to have a solution for ourselves. The only a limiting factor for that system is only as good as the number of provider who use the system. So we do have provider who give the vaccine, but they are not on Othina. But for everyone who enroll in Othina and use Othina, we capture all of that. And I want to tell you that there's over 700,000 residents in Orange County have used Othina. And then there's over 500,000 have gotten a shot on Othina. And so for those people who have gotten their vaccine on Othina, we have it by the zip code. And so there is a map currently on our website, tell you by zip code how many people have been vaccinated. You can look on it on our website. With the caveat that that number is not complete because we do have provider in all of Orange County that are vaccinating people, but they're not using Othina, so we don't have that reports, okay? So please view it, know that the number in your city are underreported because of that very issue that I discussed with it, okay?
If I can go back to Mayor Kalmick's earlier question about the pot, when you look at the limited number of doses that we get each week, and then you factor that in with the case rates that are different within cities and within zip codes in the county, and then with the different criteria by which the state measures each county's performance, which then translate to our tier classification, which then translate to our ability to open up. You can see it's kind of a tricky, right? It's a very delicate thing that we have to do, and that we need to address where the case rates are the highest, but also to take into account the equity aspect of our vaccination and testing and all of that as well, because the state will look at those things and we will get penalized if we don't address all of those as well. So even though we have worked out sites, potential sites as far as SuperPod, if and when we get, the 100,000 plus a week doses that we are promised, we will be able to stand up all of those SuperPods. But until then, it's counterproductive to allocate so much resource when we have not used up the capacity that we have currently. So I just want to wrap up that question a little bit.
All right. Thank you.
Very good. Dr. Chow, one of the issues that has come up in our area, especially that I've noticed, outside of the leisure world population, which has received the availability of the vaccines and the information about the vaccines, we have a lot of senior residents who are living alone, don't have access or even understand the internet or even the smartphone, don't have relatives that are local to help them. What would you recommend that they do to be able to register for the vaccine? And, so we can get those people taken care of as well.
Thank you, Mayor, for asking that question. And then if you forgive me, I'm going to respectfully put it onto you and ask that the mayors and your staff support our seniors in enrolling onto the Othina. But all that aside, we have created a hotline for any of our citizens who need help with, have question about Othina, or who need help or the vaccine, or who need help to get registered onto Othina. Please call 714-834-2000. Again, 714-834-2000. We have staff who speak the various languages. Thank you to Chairman Do, who are forcing me to, pounding on us that we have to get people who speak the different languages in Orange County. And so we do have staff that could directly speak the languages like Korean, Vietnamese, Spanish, and English, of course. But then in cases with rare languages that we don't have anyone who speak that, we can use the language line to support them. But definitely, folks should call that number if they need help. But I'm also would appeal to all of you to support us by having your staff assist folks to do that as well. And if any of your staff have trouble with navigating Othina, we can always set up a training. But for someone who are technology shy like myself, Othina is pretty easy to navigate around. So
thank you.
Thank you
very much. Supervisor Do, we would like to thank you and the Board of Supervisors for the grant support that you guys have provided to the cities. It's been very helpful to many of our businesses. And so first, we'd like to thank you for that. We were wondering what understanding or guidance you could give us about the news that we've heard at the national level about additional support coming. What might be coming to the cities and the businesses from the news we've been seeing nationally?
Thank you, Mayor. The Recovery Act is going to be the stimulus that is so much needed at every level, whether it's public or private. it's going to help a lot for us to climb out of COVID economically. I'm happy to report that under the Recovery Act legislation, which I hope President Biden will be signed into law soon, Orange County is going to receive a total of $1.33 billion. So that's between the 34 cities and the county. Seal Beach alone will get about $4.5 million. Los Angeles will be 2.2, and Cypress about $9.2 million. And that's in addition to what we received at the county. We understand on the Board of Supervisors that the health aspect of COVID is one component. It's certainly a huge one, but no less significant is the economic impact and the financial impact on businesses and families. I never lose sight, and none of us here at the county lose sight of that fact. When we work on COVID, we think of the individual, the impact on them, on their families, and so the economic stimulus that we tried our best over multiple tranches over the last year to try to dole out financial support to businesses is our effort to the degree that we can to support our economy. And just like at the cities, many cities have stepped up and helped out with many measures. And I think collectively, we all are driven by the same motivation. And that's why we serve in the positions that we serve. And there's never a time that I feel like our calling to serve as an elected has never been needed. Our services have never been more needed than now.
Thank you very much.
Dr. Chow, you know, we've talked about the vaccines that we've been using up to this point, the Moderna and the Pfizer, and we know that the Johnson & Johnson vaccine is coming. Do you look down the horizon? Do you see even other manufacturers joining in and being able to provide vaccine for either first and second doses, or we hear talk even of booster shots in the future?
That's a very complicated, several parts question, Mayor. let me tease them apart and answer that. And so, as you know, Pfizer's are 2 shots, 3 weeks apart. Moderna is 4 shots, 2 weeks apart. No, sorry, 2 shots, 4 weeks apart. And then the new Johnson & Johnson is a single shot, okay? The CDC just issued a new guidance that information guidance that in order to achieve your own personal immunity, you have to be 2 weeks out of the second shot for the 2-shot series vaccine. And then happily report that for the Johnson & Johnson, it's also 2 weeks out after you've done your shot, rather than 4 weeks, as some of the report early on talked about. And so the achievement of personal immunity is great with J&J. We heard that the AstraZeneca vaccine, which AstraZeneca and Oxford University came together to create, will submit the application. Perhaps latest will be the end of the first week in April. As you might be aware, AstraZeneca has been approved for use in Canada about 3 weeks ago. And then there are 2 possibilities, one produced by China and the other one produced by Russian, will be, they're contemplating on submitting the application sometime in April. For those of you who are interested, the Russian vaccine has already been approved for use, authorized for use in Mexico about 3 weeks ago. So I'm very, very hopeful the more vaccine platform available, the more availability it is for us. And the subsequent vaccine will be much cheaper than the first 2 that we have. And so the ability for the US acquire more vaccine. And I think that's why President Biden is very confident that by the end of May, we should have plenty of vaccine for those who want it. And with that, I want to put a plug, and again, asking you to help us in really educating our resident in your in your jurisdiction, give them the fact about vaccine and encourage them to accept the vaccine, because I think ultimately the limiting factor will be folks who are hesitant to receive the vaccine. So anything we can do to encourage folks to receive the vaccine will be better. Like I said, we have no way out of the pandemic without the vaccine, period. Thank you.
Thank you.
Thank you. Chairman Do, there's a lot of concern and interest among our residents about the ability to reopen schools. And we know that we operate under state guidelines. And so we see locally a variety of programs, some schools open full-time, some schools still doing fully virtual. Can you give us any guidance or insight about the ability to reopen schools more fully for the fall time of the year, please?
We worked really hard through the healthcare agency and Dr. Chow to provide the support as far as the vaccines in order to facilitate the reopening of schools. But ultimately, that's a school district decision. Having said that, the state made the school opening a priority. And that's why fully 10% right off the top of all the vaccines that we receive are required to go to K through 12 educators. So 10%, that's right off. So out of every 100 doses that we get, right off the top, 10% go to educators. So that shows that the commitment from the state and certainly from us as well, that in-school education for our children is something that is absolutely critical. More than just the educational component of it, there's a socialization, is their mental health, is their well-being, is a sense of continuity and a routine in their life, the discipline of going to school. There's so many life lessons that comes with that, that it's not just about going back to class and maybe taking some of the pressure off of the parents.
All right. Thank
Very
you.
good. Dr. Chow, recently in the news, we've seen, the governor start mandating what we call set-asides, such as the 10% for teachers and essential workers. Could you give us a little insight into that process? Because it seems to change almost on a daily basis and can be confusing. It's certainly confusing for me, and I can imagine even at your level, it can be confusing to try and fulfill that. And so if you could tell us also, what are the currently mandated set-asides that we have?
Yes, sir. I'm going to try and get that. It's going to take a while, but let me try. And so Chairman Do is absolutely correct that the governor really put the student, especially the preschool or K to 12, at the top of priority as is related to vaccine. Now, I want to caution us that we need to understand that per CDC guideline, vaccine should not be a factor in school reopening, and it shouldn't be. And actually, Orange County is the big proof of it. With the support of the Board of Supervisors, I've been working closely with Orange County Department of Education and all of the school superintendents, public and private, as well as the folks at in the institution of higher education since day one. We've been planning on it, from testing to opening school to now vaccine. Orange County, I'm very proud to report that Orange County, because of the work of the superintendents, because of the work of OCDE, and because of the work of the teacher and the community, over the last summer, we was the first county that had reopened at least K to 6 more than any other county in California. We have allowed over 136 private school open and charter school open K-6 and one public school. Now that was unheard of. And Los Sal school district was the first public school that opened in the state. And we opened safely up until now. I'm proudly said that we've not had an outbreak in any of our school at all from K to 12, right? And so what we have done is working closely with OCDE and all the school superintendent. There were some school that was not open prior to this last search was because some of the area in our community still had very high positivity rate. Remember the equity metric, it was high, that it was unsafe, and it was up to the school, the teacher, and the community to negotiate and to weigh out the benefit as well as the negative effect should a school open. And so that is an ongoing conversation. Now that our equity metric has dropped so low, I'm so pleased to tell you that almost all school was talking about opening for in-person instruction. So that is the most exciting thing. But remember, until we officially get into the red tier, no school is allowed to reopen except for those who previously opened. And so I'm looking forward to more school opening, more opportunity for children to come back for in-person education. My team continually working very closely with all the school. We are the first county and the very few county that have spent our care dollars to really stand up a medical team to support all school in Orange County. So we contract out with Chow Hospital, with UCI, a group of pediatrician and specialists, and my own medical team with public health nurses have always been available for school to call and ask for help and answer their questions 7 days a week related to COVID infection in school. And I think that's the reason why we've not had an outbreak in any of our schools.
Dr. Chow, you want to mention the educator pod?
Yes, sir. I thought you mentioned that. So answer your question about the, see, I got so excited about school, I completely forgot your question, Mayor Kalmick. Thank you, Chair Do. So the state require us to, right up the top, 10% of our vaccine have to go to preschool to 12th grader educators, right off the top, okay? And so we've been preparing for this with the school district and OCDE way before the vaccine was available. And I leave it up to them to make decision to tier who are the top tier to come in and get the vaccine. Because remember, they have to agree. Everybody have to align into how we're going to tier the educator because the limited amount of vaccine. 10% of 40,000 doses a week is not a whole lot. That's 4,000. But there are 150,000 educators in Orange County. Preschool to 12 only, 150,000. So 4,000 doses is not a whole lot. And so on top of that, I have been working with CVS, Walgreens, Rite Aid, because these pharmacies receive the allocation directly from the federal government, so a separate part. So I've been working with them to ask them to help us vaccinate the educator. And I'm happy to inform that that is happening right now. And so we on top of the 10%, our educators also have access to CVS, Walgreens, and Rite Aid portion of it. So then we take 10% off the top, then the remaining 90%, 70% has to go to seniors 65 and older. Yet we still have to do that because Orange County has about 500,000 seniors 65 and older. And I believe we have successfully vaccinated close to 75% of them. So we still have 100,000 senior or so to go. That's a lot. And then the remaining of the remaining 30% of the 90% will go to the rest of the folks who are emergency providers, food and agriculture provider, and the educator in the institution of higher education. They were carved out from the 10% and lumped into the 30%. Okay. Then most recently, a few days ago, you probably heard that the governor adding in this formula, a 40% for those who live in the lowest SES quartile in the state. So let me explain that. California has over 1,600 zip codes. And so the governors look at the lowest quartile, which are 400 zip code in the state, okay? That comprises of about 8.1 million Californians. And he said 40% of the vaccine has to concentrate on those community, because when we look at those who are infected and have died from COVID up and down the state, 40% of those death and infection rate occur in the lowest state, lowest SES quartile, socioeconomic status quartile, these 400 zip codes, okay? Up until last week, only less than 16% of Californians living in these 400 zip codes have been vaccinated. And there's a push in really making sure that we make vaccine access to folks who are living in this 400 zip codes. Now, there's a difference between the lowest SES quartile in Orange County versus the lowest SES quartile in the state. So out of those 400 zip codes, Orange County has 4. So 4 zip codes in Orange County belong to that 400 zip codes in the state. And those 4 zip code, unfortunately, Chairman Do owns 3 of them, 2 in Santana, 1 in one in Garden Grove, and then Vice Chair Chafee has the 4th one in Anaheim. I can rattle it off for you: 92701, 92703, and then 92805 and 92844. And so the goal is for us to really hone in, go in, and vaccinate people, our residents, our citizens in this county who live in those 4 zip codes, of course, based on the eligibility list. And in Orange County, those 4 zip codes comprise about 169,000 people. Again, remember, put in reference, we only get 40,000 doses a week. So that is the complication. At this point, we are not clear how that 40% factor into the 10% and 70-30. We're waiting for the state to give us a clear formula on how that would happen. But in my mind, I have to go in and vaccinate people. The other thing you probably heard me talk about is that other county, I won't name them, made it very clear that they only vaccinate people who live in their county. If you work in their county, they won't vaccinate you. I think that it's unethical. Sorry, that might be too harsh. I think that that is not right. If you live in other county, but you come here and you work in this county and you contribute to our economy and you provide services for our citizens, we should vaccinate you because you interact with our citizens. And so I made it very clear that in Orange County, we will vaccinate people, not only live here, but work here, especially they have proof that they work here, serve our people, contribute to our economy. So that's what we're moving forward to. So that bucket is bigger, right? And so if you look at how many vaccines have been in the arm, it is unfair because of those, we have 894,000 vaccine that are accounted. Remember, the state account based on the zip code where you live, not where you work. And so I believe that we have put more vaccine into people because we also vaccinate people who work here, not just live here, but it's not accounted for at the state.
Great, thank you.
Thank you. Mayor Kalmick, I know we have many, many more questions, but we have reached the end of our time.
Great. Well, we really want to thank both Chairman Do and Dr. Chow for taking the time out of, I'm sure, your very busy schedules to help us reach out to the residents and other interested people to give us this kind of information. You know, very often I'm on the Friday morning calls with you, and it's very enlightening. It's confusing, but enlightening. So thank you for giving us this opportunity for the residents to hear.
Thank you, Mayor. You mean I wasn't clear on our Friday morning call? You got to
No.
call me out so I make it clear.
You're very clear. The circumstances change.
Yes.
It's my pleasure. Thank you for inviting us.
Thank you both. Thank you all.
Thank you very much.
Okay.